So the meniscus is like a piece of rubber. It's a shock absorber in the knee. It has multiple different functions. And one of the functions is absorbing load, allowing distribution of force through the knee. It also contributes to stability. A meniscal tear is an injury to this structure that can result in pain, clicking, locking, swelling, and catching sensations. There are two broad types. So one is a traumatic injury where you damage it, where you might twist or turn, or when you're running or playing any sports. Second is a degenerative problem. So as we progress with time, things start to wear out and they reduce or lose part of their function and integrity. So usually meniscus tears can be either one of them or a combination of both. With any orthopedic problem, and meniscal tears are absolute classic. There are always two options: non-surgical management and then surgical treatment. The non-operative or the non-surgical treatment are things like targeted specialist physio, where the physios help to build up strength, range of motion, balance around the knee. Second, modification of activities, so changing the way that we do things or avoiding anything that exacerbates the pain or the problem. Third, simple things like painkillers. Fourth, lifestyle changes, eating, drinking, sleeping properly, watching weight, all really important non-operative treatments. Second are injections. So injections are very low risk options. There are various different types. They have risk, but this is really small, and they're usually temporizing measures. And then the surgical treatment for meniscal tear can be either removal of the damaged part of the tissue or repair. Nowadays, we try to preserve the function of the meniscus. So plan A is try to repair the meniscus to restore the function of the cartilage. So the recovery process for the treatment depends on exactly what's done. For the surgical treatment, there are two options. One is removal of the meniscus, and second is repair of the meniscus. These are usually day case procedures where the patient comes in the morning, they'll be home by the afternoon. Part of the recovery process involves physiotherapy. In terms of timelines, usually it takes approximately 2 weeks for the scars around the knee to heal. We take the stitches out. For meniscal removal, which is called a meniscectomy, the recovery process is slightly quicker. So it can take up to 6 weeks for the pain, the swelling to settle down. This is variable. However, for meniscal repairs, because we try to protect that joint and we want everything to heal, the healing process is longer. So usually we place patients in braces for 6 weeks, and then the healing process takes 3 months, and then the rehabilitation period can take up to 6 months before they return to their sports. It really depends upon your symptoms and how you're feeling. If you've hurt your knee, if it's painful, it's swollen, it has reduced your function, you have clicking and catching, and you are worried and it's not settled, then it's really important to have this checked. And part of what we do looking after patients is making an assessment, because not everybody needs always to have an operation, but it's so important to have an appropriate assessment and guidance and diagnosis so we can give you the best treatment. I would recommend coming to Hospital of St. John and St. Elizabeth because of a few factors which are so important for patient care. Number one, the theatres are absolutely brilliant. So state-of-the-art, brand new, excellent facilities, and the flow through theatres and the processes are streamlined. And number two, which is really important, are the team. So the nurses, the anesthetic teams, the physios, the admin teams work so well together, and this is key to allow us as a team to give patients the best care.